How do I know if I should have a lumpectomy or a mastectomy?
So in terms of managing the breast itself, getting the tumor out, historically, there are two ways to get rid of this tumor. And back in the beginning of the 1900s, what was done was a radical mastectomy, Halsted radical mastectomy, and the breast was removed, and the fascia and the pectoralis muscle and all of the lymph nodes, and it was quite a deforming surgery, but quite effective in really clearing out the local disease. And then over time, studies were done that demonstrated that um, less surgery, a more confined, you might put it, mastectomy, resulted in similar outcomes. It has been recognized that doing a more aggressive mastectomy did not result in higher cure rates and lower death rates. And so as this surgical mastectomy procedure evolved, there were studies done to see, can we keep the breast, can we preserve the breast and just remove the lump and look at the lymph nodes? Will our outcomes, will our cure rate, will our death rate be hurt by that? And in fact, women who do breast conservation, which means a lumpectomy and then radiation to the breast, have exactly the same death rate as women who choose a mastectomy. So in early stage breast cancer, stage 1 and stage 2 breast cancer, what we call the local therapy, whether they get a mastectomy or whether they do breast conservation, has little, if any, impact on the death rate from breast cancer. And this is because breast cancer is way more than a tumor or a mass in the breast. It is what we call a systemic disease for many women, that the breast cancer is not only in the breast, but it's in the blood, it is in the lymph, and it's circulating around the whole body. And this observation that these tumor cells that in some women have broken away from the breast before the woman or doctor ever knows that there is a tumor in the breast, that these circulating cells are the reason why some women die of breast cancer, and are the things that we need to impact in order to change cure rates and death rates. So when women are thinking about what local therapy they're going to accept, we strive for breast conservation. We try to give every woman the option to keep her breast. Now, there are some women that just really can't keep their breast. Now, if you are diagnosed with breast cancer when you're pregnant, depending upon where you are in the pregnancy, it is not possible to give radiation. So some women who are diagnosed with breast cancer while they are pregnant, their only surgical option might be a mastectomy. There are some other medical conditions where radiotherapy just makes the tissue, the breast tissue, look really, really ugly. And one of those situations, fortunately, it's a rare situation called scleroderma, that women that have this type of additional medical problem are not good candidates for radiotherapy. It just does not give them a good cosmetic outcome. Women who are known to have 2 or 3 separate breast cancers in their breast, what we call multicentric disease, where the surgeon would have to be doing a lumpectomy, say in the upper outer quadrant of the breast and the lower inner quadrant of the breast. that's going to leave a really funny looking breast with not a good cosmetic outcome. So frequently women in that situation are guided to a mastectomy. Depending upon the size of the woman's breast and the size of the tumor, if a woman has, say, an A or a B cup breast and a 2 to 3 centimeter breast cancer, depending upon the location, she too may not get a very good cosmetic outcome from breast conservation. So the goal at the initial assessment is to determine really, is this woman going to have a good cosmetic outcome if she is offered breast conservation? That's number one. And number two, do any of her other medical conditions prohibit her from receiving radiation therapy? Now, in more rural areas of the country, women make a decision sometimes to have mastectomy because they don't have the ability to commute on a daily basis to a center where there is radiation. So that's a struggle for some women who don't have easy access to a radiation therapy unit, and also some older patients who, even if there is a radiation therapy unit nearby, that they're somewhat infirm and just getting up, getting dressed, getting out every day is not in their best interest. They sometimes would choose a mastectomy instead.
What about genetics? How does that play into my decision?
Now, in terms of the genetic risk assessment, so we now know that there are several genes that some families carry, and therefore some women with breast cancer carry, that predispose them to a higher risk of breast cancer than the general population. And more than that, predispose them to a high rate of getting a second breast cancer event in the other breast. The genes that we know a lot about are BRCA1 and BRCA2. And women who meet criteria for genetic testing and who are known to carry these genes, if they have a breast cancer diagnosis, they frequently will be guided to a decision to have a mastectomy and a preventive mastectomy. But it is not mandatory that even a BRCA carrier have mastectomies. But in the discussion, in determining what the right fit is for the patient, for the woman, certainly for some gene carriers, mastectomy and preventive mastectomy makes sense if they know there is a very, very high risk of going through this nightmare again in their anticipated lifetime. And also now we're able to detect a gene called the P53 gene, which tracks with a familial cancer syndrome called Li-Fraumeni. And women who carry the P53 gene, we know that radiation is probably not in their best interest, because people who carry this gene have a high rate of getting radiation therapy induced second cancer, a radiation therapy induced sarcoma. So these are some specific examples that breast surgeons, breast centers are looking at and trying to counsel their women, their patients, for making the best surgical choice. But really, the bottom line is that taking off more breast tissue does not improve the death rate from breast cancer. It is the systemic treatment, the chemotherapy, the tamoxifen-like drugs, the Herceptin, all of that is what has the possibility to enhance and reduce the death rate. The local therapy gets rid of the tumor and hopefully leaves the woman with a good cosmetic effect that she can grow into and feel good about herself.